Okay, so my name is Shelby Wyatt, and this is my assignment 2, option B. So I'm currently doing an acute placement at Brockville General Hospital in the emergency department. And my focus of my change analysis project is to analyze the use of the 7-inch extension tubing for peripheral IV accesses in the BGH ER. So some of the goals and objectives that I've identified. So first and foremost, I want to see how successful this change is. So I want to see how staff is complying with it. But in addition to that, I also want to see how staff are feeling towards the change and their attitudes about it. And also I wanted to see the rationale for the change because initially, before the change, they were only using the blue clave tips to attach onto the ends of the IV catheters that were inserted, but now they're using the extension tubing set, so I want to determine why that is. So the change in behaviors and practices. So like I said, before they were using only the blue clave tips, and now they're using the extension tubing set. So initially, the policy got changed at the end of 2017, but was not actually enforced by management, according to my preceptor and other nurses on the floor, until late 2018. So almost a full year went by before they actually started to implement this change. So it's still relatively new, even though the policy has been around for over a year now. Management's only starting to kind of crack down on everyone in the ER for using the extension tubing rather than just the blue clave tips. So the key stakeholders, so the registered nurses, nurse managers, and patients. So for the registered nurses, they're a key stakeholder because they're the ones actually inserting the IVs and having to use the extension tubing sets rather than just the blue clave tips. Nurse managers, because they are the ones that have to enforce and make sure that nurses are complying with the new policy and procedure at BGH when inserting IVs to make sure that everyone is following the best practice guideline for using the extension set. And then also patients, because they are the ones that are receiving the care and receiving the IVs. So my initial thoughts on the success level of this change project was that it was very successful. And that was because my very first day there, I went to go start a peripheral IV with my preceptor, and she helped me gather all of the equipment that I needed, which included the extension tubing set. And she actually showed me the policy and procedures that BGH had for inserting peripheral IVs. And as I was reading it, it said the extension tubing set. But then for a couple of days afterwards, I observed nurses inserting PIVs, and they were not using the extension set. So that's actually going against BGH's policies and protocols. So that kind of led me to the analysis of this change project. So my initial thoughts of the controversial aspects would be the cost. So it's very obvious that the extension tubing sets are much more expensive than the blue clave tips. This was verified by other nurses on the floor and the nurse manager. So I kind of wanted to see why that was, why they were doing the extension tubing sets rather than the blue clave tips. None of the nurses could really explain why that was, aside from the fact that it was considered best practice to do so. But also, going back to cost, the extension tubing sets are on the floor, but also the blue clave tips are available for the nurses to use on the floor. So I'd like to know what the rationale for that was as well, because if they wanted to implement the change for just the extension tubing sets, then why are the blue clave tips on the floor as well? Because that would be an extra expense as well. So for data collection, I plan on interviewing various staff with differing job titles and different levels of experience as well, so that I can minimize biases. So this would include interviewing different emergency RNs, including my preceptor, and getting their take on the whole change and seeing how they're complying and seeing their rationale and seeing if they understand why the change is happening. But also I need to interview the nurse manager, Nicole, for the critical care unit, so the Emerge and ICU, and kind of talk to her more about why this change was implemented, why it is considered best practice. Also, there are a couple of other nursing students, some of my fellow nursing students in the program in the ER, so I would like to interview them to see if they are using the extension tubing set as well, and if their preceptor is encouraging them to do so as well. but also to see if they are observing other nurses that are not using it. So aside from interviewing, like I said before, I observed other nurses that were not using the extension set, but I'd like to look more into it, see how many nurses are doing it, if they're doing it every time without the extension tubing set, if they are solely set in their ways of using the blue clave tip, and kind of seeing what nurses do it, how often they are doing it, and the rationale for why they're not complying with the change. But also going back to the supplies in the ER unit, so I want to assess like why there are blue clave tips and the extension sets when they are trying to eliminate the blue clave. So I'd like to kind of see the how many of each are on the floor, if there are more extension sets, if there are the same amount of each. So this is my Gantt chart. So initially I need to become familiar with the BGH-ER, sorry. And then from there, I could identify a change analysis project, which has led me to this. So I did my assignment 1 option B, and it was approved. So now this is assignment 2. And then I'm going to do data collection for the project and then interview upper management about their leadership style for implementing this project and making sure that it follows out and staff complies with it. And then after all the data collection is complete, I need to analyze how well that worked. And then I need to begin the final assignment of this and putting everything together and determining whether it was effective or not. So at the bottom here, you can see the start date for each task and then how many days that I'm giving myself to complete it. So the approach to analyze the change process and outcomes. So first and foremost, I wanted to re-interview all of the staff. So that's the nurse floor manager and the differing levels of experience of RNs. And that's to compare with the previous data that I collected a few months earlier. And so from there, we can just kind of determine if staff have the same views on it, if the nurse floor manager is trying different approaches to try and encourage staff to comply or not. And then also I need to still continue to observe management and frontline RN staff. So this is determining the percentage of the staff compliance. So by talking to the frontline RNs and by observing them, I can determine if their attitudes and feelings towards it have changed, if they are continuing to use only the blue clave tips, or if they have converted to using the extension tubing set. So this will allow me to determine staff compliance from the beginning to the end of the project and seeing if there are any differences. So these are my references. 2 of them are policies and procedures from Brockville General Hospital, and then I also have some from the RNAO and CNO. But I'd just like to point out that the 2016 Infusion Therapy Standards of Practice from Infusion Nurses Society is actually what guided BGH to create their policy and procedure on infusions. And then this is my change analysis awareness form from my preceptor. Thank you.